Today we're going to look at scleroderma, a rare autoimmune disease that affects the connective tissue of the skin, blood vessels, and internal organs. There are two general types: localized, which mainly affects the skin, and diffuse, also called systemic sclerosis, which involves multiple organ systems. Like many autoimmune conditions, women are affected more often than men, about 4 times as frequently, and the usual onset is between ages 25 and 50. The disease has a variable course with periods of remission and exacerbation. The exact cause of scleroderma isn't fully understood, but it usually begins with skin involvement. Mononuclear cells cluster in the skin and trigger the release of lymphokines, which stimulate the production of procollagen. This leads to excess insoluble collagen building up in the tissues. At first, the inflammatory response creates swelling, leaving the skin taut, smooth, and shiny. Over time, fibrosis sets in and the skin loses elasticity and mobility. Eventually, the tissue degenerates and becomes non-functional. The same cycle, from inflammation to fibrosis to degeneration, can occur in blood vessels, major organs, and other body systems. One of the most visible signs of scleroderma is the skin change. The skin and subcutaneous tissues become increasingly hard and rigid. Wrinkles and lines are obliterated, and the skin becomes dry because sweat secretion is suppressed. The extremities may stiffen and lose mobility. For some patients, these changes stay localized in the hands and feet for years. The face can take on a mask-like, immobile appearance, sometimes referred to as stone facies. The mouth becomes rigid, making expressions and oral movements more difficult. But the internal changes are even more important. The esophagus can harden, interfering with swallowing. The lungs may scar, impairing breathing. The intestines can develop sclerotic changes, leading to digestive issues. The kidneys may develop vascular involvement, resulting in malignant hypertension and renal insufficiency. Cardiac involvement may include pericarditis, heart block, or myocardial fibrosis. A classic cluster of symptoms is called CREST syndrome. CREST stands for calcinosis, which is calcium deposits in the tissues, Raynaud's phenomenon, esophageal dysmotility, sclerodactyly, which is scleroderma affecting the fingers, and telangiectasia, which are dilated capillaries forming vascular lesions. Assessment begins with observing sclerotic changes in the skin, contractures in the fingers, and color changes or lesions in the fingertips. Because systemic involvement is so significant, a thorough review of gastrointestinal, pulmonary, renal, and cardiac symptoms is important. Nurses also need to assess limitations in mobility and self-care, as well as the psychological effects of changes in body image. There is no single diagnostic test for scleroderma. Diagnosis is generally based on clinical findings, and if a patient presents with at least 4 of the 5 symptoms that make up CREST, the diagnosis is strongly supported. Treatment focuses on symptom control and supportive care, because no medication can alter the underlying disease process. Organ involvement is managed individually. For example, the use of ACE inhibitors in patients with renal involvement has dramatically reduced mortality from hypertensive kidney disease. Beyond pharmacology, patients benefit from counseling to set realistic goals, supportive measures to reduce pain and disability, and moderate exercise to help prevent contractures. They're advised to avoid extreme temperatures and to keep skin moisturized with lotion. Nursing care centers on managing the primary concerns: impaired skin integrity, self-care deficits, nutritional problems, and disturbed body image. In advanced cases, patients may also face impaired gas exchange, impaired cardiac output, impaired swallowing, and constipation. Preventing complications of Raynaud's phenomenon is a key nursing challenge, as is protecting the skin and helping patients adapt to the many physical and emotional changes that come with the disease.